Brittny. Welcome back to my channel. So today I am recording this video to let you all know about my preceptorship at University of Florida College of Medicine. At the end of our first semester, we have a 2-week-long preceptorship where we, as first-year medical students, go out into the community to spend some time working with primary care physicians in the clinic. And this gives us the opportunity to expand on our clinical skills early on in our careers and to apply the things that we've learned in class so far to actual real life patients in a real life clinical setting. For this preceptorship, I am working with a pediatrician in Miami. This is my second week working here, and I must say that I absolutely love it. I love peds. I love this office. I love the location. I love the patient population. I love that I get to practice my Spanish, and I must say that I can understand more than I actually speak. But one day when I get the confidence, I will definitely speak in Spanish. The main thing that we have to do for our first preceptorship is to take patient histories. And so in school so far, we've done a lot of history taking on standardized patients. Now we actually get to be in clinic and take actual histories on real patients. So that's pretty cool. Before we go on preceptorship, we had a week long of lectures on different things like common pediatric diseases that we would see, adolescent health, which was great for me because I knew I was going in to see a pediatrician. Some of my other classmates are doing their preceptorships with internal medicine physicians, or what would you call them, internists. So there's internists, there's pediatricians, there's family practitioners. They basically gave us lectures on diabetes, hypertension, the common things that we would see in those professions, you know, acute otitis media, ear infections, upper respiratory infections, that kind of thing. So I think, and then we had an exam at the end of the week. So those lectures prepared us for what we're seeing. I'm actually very grateful because my preceptor, he asked me questions, or, you know, whether it's which marker would we be looking for if we're looking for chronic inflammation, and or like he would just ask different questions, or how would you describe this eardrum or this tympanic membrane that's infected? And I would have to say, oh, I remember we learned this in my lecture. And so it is erythematous, it is bulging, the bony structures are absent or occluded, there is fluid behind the membrane, that kind of thing. So having the answers to those questions definitely is great, and is an ego booster. So it's been good. There's been a couple of questions that have me stumped, but for the most part I've been able to answer all of them, which is nice, and he's very nice about it. I know that people talk about being pimped, but he's not like that. My preceptor is amazing. He uses his questions more as a learning opportunity and to push me to think and to put the pieces of the puzzle together to come up with an answer. So that's great. Like, I learned about the different cyanotic and non-cyanotic heart diseases or heart defects. I learned about Tetralogy of Floyd, the 4 components of that. And so instead of him giving me the answer, he had me go look it up, and that way I could remember it. So let's see, Tetralogy of Floyd, the 4 components of that are ventricular septal defect, right ventricular hypertrophy, oh snap, aortic stenosis, and overarching aorta. Let me check that. I think I said aortic stenosis. It's pulmonic stenosis. So I got 3 out of the 4. So the 4 components of Tetralogy of Floyd are ventricular septal defect, pulmonary stenosis, right ventricular hypertrophy, and an overriding aorta. I think I said overarching, but you all, I'm 1/8 of a doctor, so cut me some slack, okay? At UF, they teach us, they've taught us pretty much, we've learned a lot of different physical exams: cardio, pulmonary, musculoskeletal, GI, HENT, so head, ear, what is it? Head, ears, nose, and throat, but there's 2 E's, so I'm missing something. HEENT. Oh, head, eyes, ears, nose. This is nose. Head, eyes, ears, nose, throat. Yes, that exam, our neurological exam, all those different exams we learned. And so far, I've done a lot of the HENT, feeling for lymph nodes, checking the ears, checking the nose, the throat, definitely the eyes. I've listened to a bunch of hearts, did a cardiovascular exam, heard a few murmurs, or tried to hear a few murmurs. My preceptor is amazing at hearing murmurs. It doesn't matter if the baby is crying, it doesn't matter if they're like hanging from the ceiling, he's able to hear it. What other exams have I done? Pulmonary exams. Definitely every child that comes in, you listen to their heart, you listen to their lungs, you palpate their stomach, so you do your GI exam, those sorts of things. So I've had the opportunity to kind of put into practice what I've been learning in the LAC, which is our Learning and Assessment Center at UF. And so yeah, it's great. We even put earrings. Well, I didn't put earrings in, but one of our patients, she got earrings in, so that was pretty cool. And what else can I say? I've seen so many things in peds that I didn't even think that I would see. So far I've seen one of the major cases is 2 twins who were born, and one of the babies, they were full term, healthy 7-pound babies, and in the first 24 hours, one of the babies, baby B, ended up going cyanotic. So he turned blue and purple, and around 24 hours is when the ductus arteriosus closes. And so that happened, and my preceptor called it. He called it. He said, this is a TGA, and the baby had no murmur. He was perfectly healthy before that episode, and it came out that he had a TGA, which is a transposition of the great arteries. And so basically what that is your right side of your heart pumps blood to your lungs, deoxygenated blood to your lungs. The blood picks up oxygen in the lungs, comes to the left side of the heart, and then out of the aorta, which brings oxygenated blood to your body. So your upper extremities, your arms, your head, and your lower extremities, your legs. And in this baby, his pulmonary artery and his aorta were reversed. So deoxygenated blood was going to his body, which is why he turned blue, and oxygenated blood was going to his lungs. But this is typically seen when the ductus arteriosus closes, because there's no more mixing of the blood between the right side of the heart and the left side of the heart. So he ended up having to have open heart surgery, and which was successful and is recovering. So that was interesting. I've also seen a pneumothorax. What else did I see? I saw so many things that I just never thought. Of course, you see the typical strep, the flu, ear infections, the acute otitis media, the rhinitis, the stomach bugs, but I also got to see some really cool things like SMA syndrome, which is superior mesenteric artery syndrome. I got to see lots of molluscum and pedigo staph infections, viral infections. Another thing that's great about the preceptorship is that you basically do whatever your doctor does. If they have to make a hospital run and you're in a clinic, you make the hospital run. I'm in a private practice in a clinic setting, not in a hospital. For the TGA, transposition of the great arteries, we had to head over to the hospital and check on the baby, check on the mom, and then come back and see more patients in the clinic. So I got to go along for that. I got to see the baby being transported to the children's hospital. And what else can I say? I mean, it's been a great experience. I've learned a lot how to coax the small children into, letting you perform different exams on them, and how to soothe them, how to talk to families, what type of questions to ask. And it's definitely a learning opportunity, because it's one thing when we're in class or we're in the LAC and you have your locates, these are the different components of the physical exam or of the history that you're supposed to obtain or you're supposed to do. You go down the list, you're like, locates. Okay, can you point with one finger where the pain is? Okay, can you characterize that pain? How does it feel? Can you describe that to me a little more? On a scale of 1 to 10, how can you describe this pain, with 10 being the worst and 1 being the least? So you go down this list in your head, but when you get into clinic, it's not like that. You're not gonna go, at least in my experience, it hasn't been like that. It's more of a conversation, and you use that to guide, to make sure you got all the information that you need. And even though I've been taught all of these these things, there are still things that I missed. You know, I'm still a work in progress. So that's just the takeaway from that, is that in real life, you're not a robot, and you're not gonna, if you're sitting there thinking about the list of things you have to ask, the patient's gonna be looking at you like, oh, actually, I did that with a patient, and we had just finished talking about fever and how long the fever has been around, and I was still going in my head about what I needed to ask next. And then I asked her, so has he had a fever? And she looked at me like, we literally just finished talking about a fever. But in my head, I was going through a checklist, and that can sometimes cause you not to really listen or to think. Listen to what the patient is saying, most importantly. And so I had to like take a step back. Well, let me not go through the checklist. Let me just ask questions that I think would be important to know. So, and I have been very fortunate to be in this office and to learn from the physician that I'm learning from. He is amazing, but he is excellent. His patients love him. He's highly recommended, highly respected. He has awards all over the place, and he's just great. He has great bedside manner. I understand why he is beloved by his patients, and he's a great teacher too, because he challenges me. He's patient. He is a great role model. And so I'm just like very fortunate, and I think that I've been very fortunate in my interactions with the physicians that I've had the opportunity to shadow, because I shadowed a family practitioner in Tampa, and he was amazing. His patients felt the same way about him. He remembered everybody's family history. He just was amazing. And then I shadowed an ophthalmologist who was also amazing, very thorough, her patients loved her. She was so smart, and just having them as role models, and then now the doctor that I'm working with, it's just, I'm very, very, very blessed. So, okay. So the preceptorship allows us to use our recently acquired interviewing skills in a real life clinical setting, while simultaneously shadowing a primary care physician who serves as a role model and mentor and teacher. So it is great valuable experience for us, because it's one thing to learn the information, but to apply it to actual patients, it's more likely to stick, and at the end of the day, it's going to make us better physicians. So this is a great opportunity to model a physician, and also to learn to work as a member of a healthcare team. So it's not only about learning from the physician. You can learn from the nurse that works here, or the office manager, or whoever it is, the residents that you're working with. There is so much opportunity for learning and developing during the preceptorship. And you know, I just encourage you, when you go into your preceptorship, talk to them about everything. Ask questions about everything, not just about what you're seeing or the patients you're seeing, because yes, that's important that you acquire that knowledge, but I ask questions about what it's like to run a private practice, or what it's like to work in a private practice as the nurse, or as the office manager, or what have you. What kinds of things should I be thinking about as far as business if I wanted to go and open my own private practice? Any tips for networking? This is your opportunity to, you know, really ask the questions that you have, because I mean, your preceptor is already in the profession. They've been here, they've done it, and they have a wealth of knowledge. So it's just a good idea to just tap into that while you have the opportunity. One thing that I would like to walk away with during this preceptorship is improved ability to present to the attending, and also to improve my history taking skills. But not only getting the history, but being able to present that to the physician in a concise and clear manner, and giving the pertinent information and knowing what is pertinent. And so that's very important. That's going to serve me well when I am doing rotations as a 3rd and 4th year, and as a resident, because that's what I'll be doing with every patient. So I just want to get that down, and I've been struggling a little bit, but I don't let that defeat me. I actually, the first few times that I presented to my physician, it was horrible. And he gave me feedback, and we talked about things, and then I just would take the initiative and go see another patient and ask him and present and ask him, like, did I do this better? What else should I work on? Is there something else I should have asked? Okay, keep that for next time. Okay, I'm gonna go see this patient before he even says, hey, go see this patient, you know? And so I think that's the mentality you have to have. It's like, it's okay not to know everything, but have the desire to know and to improve, and that'll serve you well. Thanks for watching, guys. As always, if you like this video, don't forget to subscribe. If you want to see any specific videos, please comment below and let me know. If you have any questions, let me know. If you've done a preceptorship before, let me know about your experience. I would love to hear it. And if you have any advice for me as far as like improving on history taking and presenting, I would love to hear from you guys. And I really appreciate you all watching my videos, and I love you, and I look forward to the next one. Peace. It's my last day, Dr. Floyd. And this is exactly how I'd like to end it.
This is how we do it. This is how we roll. Sunset Pediatrics.
Yes, this is how we roll.
Unfortunately, as we roll.
Yeah.
And get rolled.
Especially him.
Yeah, right.
Me, not so much.
The old guy.
Just kidding.
It'd be a heat though.
Oh, good catch.
Yeah, man down, man
Good
down.
catch. Sorry, it messed up your
Man
everything.
down. Okay.
So this is garlic bread or croissant?
That's fine, croissant, that's fine. How's mom?
I love it here.
Wonderful.
Good.
The camera doesn't work by itself.
Or garlic bread.
The bread.
You know, you have to make sure you get the good shots.
Oh, and drinks.
Oh, stop.
Sit up so I can look at myself. Hi there.
He was just singing.
Dun 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 dun.
How many followers do you have on your
Dun,
blog?
dun, dun,
5,000 plus.
5,000? Really?
That's a lot.
All the food is gone. Dessert time!
So you add the cranberry sauce, okay? Made by my
Dr.
mom, the
Susie.
cranberry sauce.
Made by who, your mom?
Who makes a good cranberry sauce?
Don't do that. Hey, Bassett, how you doing? Okay.
Yeah.
Going live?
Going
Are you
live.
streaming or just taping?
Probably not.
My generation knows all about taping. First it was 8.
You're teaching me this.
Can you put your gloves on a little tighter? They're kind of
That's
loose.
what I told him. He said these are the smallest he has.
You gotta do better than that. You gotta just pull on them. Pull them tighter. You can't be sloppy. Don't be sloppy.
I'm dying laughing.
We don't roll like that at Sunset Pediatrics.
Girl, you cannot be a surgeon.
What? I would have size small gloves.
No, you'd have numbered size gloves.
That's true.
Off. Pop the thing off. There you go.
Okay, so I'm going.
That's a
I'm
lot.
not gonna put it in.
No.
I'm just gonna.
Has to be at 15 degree. Wait.
I'm not putting it in until you tell me I'm doing it
It has
right.
to go like, wait.
I'm putting it
Right
right
there.
there.
Yeah.
You always want to
All
go
right, I'm
with,
not ready for this yet.
you
Okay.
want to go with the direction of the vein. So
Yes.
if the vein's like this, you want to go in like
15
So
degrees.
it's a big
that
angle. It's a
15?
big angle, girl. There you go.
This is 15.
Yeah, 15. That's why I said 15.
Okay, you ready?
Mm-hmm.
We're ready.
Go.
Might as well take a tube of something, JD.
Yeah.
Oh my God! I did it, guys! I
What
did
do you
it!
need? Need anything done?
There you go.
Your first blood draw.
I did it! First try. Thanks, teacher.
Yay.
Thanks, teacher number 2.
Number 1, actually.
He's number one.
Number 1.
JD knows that.
I did say 15 degrees, not him.
Yeah, oh, true.
I told you your angle's too big. Pull it off.
Okay.
You did good, girl.
Thank you. Do I just push it in?
Yeah. That's up the tourniquet. So here's the important part.
Thanks, Doc.
You're welcome, Doc, to be.
Here's what you do. When you're gonna take it out, right? You fold it like this. You come hold it. You don't have to hold it anymore.
No, you're done with
Oh,
it.
okay.
Pull from here. Pull from here. Pull
Apply
it.
pressure.
Pull it.
Pull quickly. There
There
you go.
you go. Now this
It's really important for safety.
this
It's called
with
a lure
one
lock.
finger, you just pull like this.
There should never be
Got it.
exposure to blood or needles.
Exactly.
And then before you do anything, grab this here.
And put in that
He's
red.
got that. Throw that away.
And that red thing.
And the shark container. Hold on,
Yep.
hold on. Wait, you're using proper OSHA sterile bloodborne pathogen procedure. We're going
Do I
right now.
just open it?
Nope, it's open on the top.
There's a hole in the top.
This isn't short people
Don't put your
friendly.
fingers in there.
Okay.
Okay.
We did it.
Beautiful.
We did it. We did it. Would you like a band-aid?
You should have went to film school instead of
Bandito.
medical school. Blogger.
Brittny the blogger.
Brittny the blogger is saying peace out.
Bye, Brittny.
Bye.
Peace out.
Peace
Grab
out.
a bite, please drop in.
Oh, of course.
Mind visitors.
Thank you. Hey guys, I just left the office and I just want to say that I had the best preceptorship that I could have hoped for. The team that I worked with was amazing, is amazing. It was such a blessing to be a part of their team for 2 weeks. I hope that you all enjoyed this video. If you have any questions, please comment below. I would be happy to answer them. I can't believe I got to do and see all of the things that I did. All I can say is just God is good, and I am blessed, and I am richer because of this experience, and I definitely don't take it for granted. Maybe I should take these off because of the glare. It is such an amazing experience that my school offers this to us as first-year students. My preceptor said he didn't get anything like this when he was in medical school. Granted, he was in medical school quite some time ago, but don't tell him I said that. A lovely experience overall. I couldn't have asked for more. Really couldn't have. Show that if you just be yourself, if you're enthusiastic about something, if you're passionate about something, then that'll show. Your interest will show, and having the knowledge to be able to apply to these things that we saw in clinic and answer my preceptor's questions was just like the icing on the cake.
In 1,000 feet, exit right.
Okay. So yeah, overall, I had a great experience. My preceptor gave me very great positive feedback that I'm going to use and I'm going to apply and I'm going to learn and grow from, so that I can be even like half as amazing as he was. And so I'm just very grateful. I'm very grateful. And Miami, you treated me well. It's a nice day out. I'm here for the weekend, so turn up. If you like this video, please rate, comment, and subscribe. Give me a thumbs up. This video can get 500 thumbs up. As soon as it gets 500 thumbs up, I will release the video of your choice. Comment down below what you want to see, and whatever has the most whatever video has the most interest is the video that I will upload at 500 thumbs up. All right guys, I love you, and I will see you next time. Bye.